Hello and a very good evening to one and all. Today at Evrox Healthcare, we have brought to you a very interesting topic called perinatal mental health. Perinatal actually means in and around the time of pregnancy. Evrox Healthcare is a digital healthcare company, as we know of, and its flagship product is the F1 app, which has been, it is about to be launched soon, and we would be talking about that at the end of the show again. So today's guest that we have, the speaker, is Dr. Dipanjali Deshmukh, who is a consultant psychiatrist. She has done her MD and is certified in perinatal mental health from NIMHANS. She is a consultant neuropsychiatrist as well. She works at Prerna Hospital, Inspiring Minds. She's an assistant professor there in the Department of Psychiatry and MGM's Medical College, Aurangabad. Please welcome Dr. Dipanjali Deshmukh.
Okay. Hello. Thank you so much for
Hello,
introduction, Surbi. And first of all, I want yeah. Hi. I want to
बोलिए
thank
बोलिए
you to
बोलिए
give me this opportunity to talk about this perinatal mental health because this topic is very near to my heart. It became near to my heart recently. So I would really want to talk about it and spread as much awareness as I can.
Yes, and Dr. Dipanjali has
Yeah.
recently become a mother. And while becoming a mother during her pregnancy and post that, she was doing the same course in perinatal mental health. So I think that is what brought you very close to this topic. And I think because of your first hand experience, you would be able to speak about it way better than anybody else. And thank you
Yeah.
very much for accepting my invitation as well.
Thank you. Like you said, I don't know how qualified I am just because I'm mother, but yeah, I did realize there are a lot of things that happen during pregnancy and postpartum, and specifically, I got pregnant during COVID. So even after
Yeah,
being a mental health professional, I had a lot of issues during my pregnancy, and I had a lot of anxiety. I and my husband is radiologist, so I used to feel like going to do the USG repeatedly. So I can just see that how much the patients might be suffering, because I have so much knowledge. I know how to calm myself and so many things that even my friends, all of my friends are also mental health professional. Still, the experience was a bit difficult, and I know it matters a lot. And there are a lot of people who are going out there throughout their pregnancy without knowing anything about it, and
that's
these
very
problems
true.
are very common. Yeah.
Yeah, that's very true.
Yes. Yeah.
So, by the way, people don't even know what is perinatal mental health, right? Because
Okay.
it's absolutely a new super specialty and something very new to the public. So, I think for today's public awareness, we should first start with the definition of perinatal mental health.
Okay. So, but like initially, at that time, you just said that it is a mental health related issue, mental health of the women during and around the pregnancy, and the duration, it varies significantly. The word perinatal, it has a different meaning for obstetricians and for us psychiatrists. So for obstetricians is about, it's about 6 weeks postpartum and something like that. But if we consider the whole problems of perinatal mental health, we can very safely assume that perinatal period can be started from the conception of the baby until the 2 years of the baby. Because if we look from the point of view of the mother and the baby, the first 1000 days, that is very crucial and critical. So I would say that all the mental health related problems and mental health of the women and even the people around her, from the conception until the 2 years of the baby, will be included in the perinatal mental health. And
All right.
yeah.
No, no, please continue. You wanted to add something.
Yeah, I was just saying ki, it is not just about the problems that we have to discuss or something. When something becomes very extreme, that only thing needs our attention. It's nothing like that. Because during the having a baby changes life of the women in a, like it's like a 360-degree change. Okay, and sometimes that change is favorable, sometimes we can accept it, and there are some instances, even though we love our baby, we feel like, oh my god, just I just want to go back to my life. And in our
Yeah,
culture, this particular feeling is not acceptable, and that also creates a
true.
huge guilt to a lot of women. So we have to sensitize everybody that even you, if you love your baby and baby might be your life, but you can still miss your old life, and that's totally okay. Because I see so many
Totally
women.
normal. Yes.
Yeah, yeah. Yes.
Yes, yes. So, what are all of those aspects that are covered in perinatal mental health?
Okay. So perinatal mental health will start from the conception, even before conception, like planning a baby.
Even
It
planning,
has been
yes.
seen that if the pregnancy is planned and wanted, it has a great positive impact on the mental health of mother as well as the baby. So your perinatal mental health will start from education about pregnancy and planning the baby, then after that taking care of the mother and the people around her during the course of pregnancy, and even after the baby is born. Okay, so it will require whatever the support she needs for breastfeeding, even the decision about whether breastfeeding is feasible or not. If there are certain problems, then what are the options are available for that, how to take care of the child, what the support mother needs for rearing a child, what support other family members need for that particular child. Everything will come under the umbrella of the perinatal mental health. So it is like before conception till until the baby becomes up till 2 years or even later also. Okay, so and if we look at the various disorders, then there are
Yeah.
various disorders like antepartum depression, antepartum anxiety, postpartum blues, postpartum depression, postpartum psychosis, even the addictions, both in
So, for the
antepartum and
public's
postpartum.
knowledge, we will have to also clarify antepartum and postpartum. What
Oh
does
yeah.
that mean?
Yes. So antepartum period is from since the baby is conceived, जो 9 months का जो period है before baby is
Yes.
born,
During
that we can
pregnancy.
say as a, yes, during pregnancy, that is antepartum period, and postpartum period is after baby is born, and this whole thing is perinatal period. Okay.
Okay.
Yeah.
Yes. So, the disorders that you were talking about. So, what are the
Yes.
disorders that come under this umbrella?
Okay. So like I said, not we don't have to address just the problem that can be disorders. There are a lot of things that
Yeah.
are that cannot be classified as a disorder but are still present. Like there is something called as postpartum blues, and it is very common. It is, there are certain studies which have shown the prevalence about 50 to 80%. So we can very safely say 2 out of 3 women might experience this phenomena called as postpartum blues, which is like a lot of anxiety, worries, and the mood shift during that period. It happens around 2 to 3 days postpartum. Peak symptoms occur by 5 day, and by 10 day symptoms resolve on their own. But that is also very overwhelming for the mother. Generally mother feels very inadequate, or whether I will be able to take care of the baby. Mood shifts are there, crying episodes, all these things are there. That is called as postpartum blues. Okay. This is a kind of milder form and it resolves on its own, but everybody should be aware about it, because so that everybody can provide support to that women. कैसे होता है ना कि rather than providing support, ऐसे हो जाता है, how can you think about baby, how can you think of, अभी इतना अच्छा बच्चा हुआ है और तुमको वो burden लग रहा है क्या. All these things are very common. So everybody should be aware कि postpartum blues are very common, and almost 80% of the women go through that. Okay, but it resolves on its
But
own
as
with
it is,
some
when a
reassurance.
when a
Yeah.
woman becomes a new
Hmm.
mother, it is
Hmm, hmm, hmm.
absolutely overwhelming and very much understandable that even
Yes,
if
yes.
she is not able to handle that or able to take proper care of the child, I mean, it is just expected in our culture that you should be born with the motherly instinct, but it's not necessary, right?
Yes, yes, yes. It's like it is assumed, we have attached motherhood, traditionally we have attached motherhood with
Yeah,
sacrifice and just letting go of
true.
yourself. And only that kind of motherhood is kind of acceptable, which is not truth. You don't have to let go of yourself. You can be yourself and mother. But yeah, a lot of people around us will not agree, and they keep on judging. And probably that is one of the problem, reason that a lot of women experience these some symptoms. And even with supportive environment also, these
Hmm.
symptoms are common. That is postpartum blues. Then there is something called as postpartum depression. So it is
Right.
a severe form of postpartum blues that we discussed so far. It will last longer, means up to 2 to 3 months it can last, and it will require a medical attention. That is something that role we have to address this problem. Because and the main difference between postpartum blues and postpartum depression is that the in postpartum blues the mood is keeps on shifting, whereas in postpartum depression there will be the pervasive sadness. The person will be sad, overwhelmed, weeping, and even the suicidal ideations might be there. So we have to keep a really good watch, and we have to screen people about this. Okay, there is a huge need for training the obstetricians and even the nurses, just how to administer. There is some questionnaire called as Edinburgh's postpartum depression screening. It's a very small questionnaire. So even if that is done by obstetrician, the
By the
lot of
nurses.
women, yeah, yeah,
Yes.
yeah, even by the nurses, so a lot of suffering can be reduced for women. Okay. And the more severe, there is something called as postpartum psychosis. So in the postpartum psychosis, there are other symptoms like the patient sometimes becomes suspicious. She might feel that baby is not her, or sometimes the
Yeah.
other experiences like hearing
There is
voices
that
that are not
paranoia.
actually present. Yes,
Hmm.
these things can also be present. Then anxiety is also very common. Okay, it is with everything, but the perinatal anxiety itself is about 15%. During pregnancy antenatal period it is about 12%. And the people who have anxiety symptoms during perinatal period, antenatal period, they are very prone to develop postnatal depression. So these things need to be known by people, so that अगर किसी को पहले से symptom है तो we have to look कि this person is susceptible to develop postpartum depression or other uh, health related problems.
Right. So
Yeah.
now, okay, there is a question. Postpartum depression is quite common. Is there a key for men, since they are built differently, to handle their partner's mood swings, anxiety, depression after the childbirth? How can they prepare?
Okay.
Good question,
So
actually.
yeah, yeah. Thank you so much for this question. Yes, like you have said, that postpartum depression is common, and most important thing, that you can just educate yourself first thing, that something like that can happen, and what are the treatment options that are available. So how much support I can give to my partner. Can I do something that so that she can have a sleep? Okay, so can I take care of baby? How can I, a lot of men might not have handled babies. So there are certain things like कि baby को कैसे ये करना है उसके, you can take care of the baby's bathing and something like that. अगर if the top feeding is going on, then both the mother and father can take turns, so that one partner can sleep and other partner can feed baby during that time. Then giving opportunity from little bit of me time for the mother can also help. uh, Taking care of himself also. Okay. As I'm talking about perinatal anxiety and depression, there are certain studies which have shown there is an increased prevalence of depression and anxiety in the fathers also. So the new father also have to take care of himself. Okay. And more, just being supportive, sometimes your partner would just need someone to lean on. Just listen to her. uh, they don't want answers to their questions, they don't want any solution, they just want someone to listen to them non-judgmentally. Because it is a bit uncommon. A lot of people, when they express that I'm feeling overwhelmed and sometimes I feel like I want to go back to the old times, so we have a tendency, no, no, but look at the bright side, the baby is so cute. Please don't do that. Just listen to her, give her that shoulder to cry on, and let her be for a time being. she'll feel better. But if you see that her symptoms are worse, that she is very much depressed, she is refusing to eat, and sometimes expressing suicidal ideation, then seek immediate medical attention. Please see the psychiatrist. Okay, seeing the psychiatrist should not be a taboo. Okay, I hope that answers your question.
Yeah, actually, even the fathers need to visit the psychologist or a psychiatrist sometimes
Yes.
because of their overwhelming, experiences. So,
Yeah.
talking about all of this, I think even if the mother is breastfeeding, not only top feeding, but even if the mother is breastfeeding, the father can be of very much help, because the father can actually, bring the crying child to the mother instead
Mother.
of her
Yes.
constantly getting up to go towards the
Hmm.
child. Also, I think
Yes.
sometimes expression of breast milk can be
Can
done
also
so
be.
that sometimes at
Yes.
night she can get a proper sleep, and that
Hmm.
milk can be bottled, and the father can actually get up and feed the child in the night hours
Yes.
specifically.
Yeah, even the just feeding is not enough. Initial few months you have to burp the child, and that is also a lengthy
Yes, a lot of
procedure.
those things.
आपको, so even आपकी partner, when she had breastfed the child, you can just take time and burp the child and make sure that he or she sleeps afterward. So if both of them are bit in they divide the load of parenting, because it is a parenting, it's not just mothering. If they both can be a partner in this, that can be a very easy journey for both of them. Now there is one question is that ki, some women get maternity leave. We are very critical of the men
Yes.
taking paternity leave, so of course they
Yeah.
have to go back to their jobs. We have to consider that also. But yes, you have to support your partner during this period, because it is a critical period for both, all three of them.
So, but paternity leave has been made quite common, I think, nowadays in all the corporate
Yes.
companies, which is a
Yes.
good thing that happened.
Mhm. Honestly, the leave that is given in our country is not sufficient. If we see, not as per the need, and paternity leave is kind of frowned upon. Even some celebrities, when they took paternity leave, it was kind of
Yeah, recently it happened with Virat Kohli. I remember.
Kohli. Yeah, yeah, yeah.
Yeah.
So when the people want to be a present father, a lot of people don't like it. So they have to tackle the stigma related to that also, stigma
हाँ
against their
मतलब
macho
उल्टा ही
images.
स्टिग्मा, उल्टा ही स्टिग्मा है. It's
Yes.
like it's not tolerated to be an absent mother in the society, and it's not tolerated to be a present father in the society, which is so paradoxical.
Yes, but things are changing. Okay.
Yeah, things are
I think
definitely changing.
a lot of countries have something called as parenting classes, in which they prepare both
Yes.
mother and father how to take care of the baby, and that is our need also. A lot of people don't know how to take care of baby, even they want to be involved, and they want to how we learn parenting is that मतलब कि baby के जो practical aspects है, कपड़े कैसे change करने हैं, diaper कैसे change करना है, by taking care of some other sibling. So generally women do that, and men don't do, at least wo
Yeah.
changing diapers and everything. So that becomes a problem later on when their own child is there. So it is expected कि mother ही करेगी.
So referring to this, what you called as parenting classes, if somebody doesn't know about it, I'd like to say that it's shown in the season one of a very famous series called Friends. So in case you have not watched Friends, which is very unlikely, but if you have, you will remember that how both the partners are
Yes.
supposed to go for parenting classes even during pregnancy of the mother,
Yes.
I mean their partner. So
Yeah.
they are even taught how to be around when the time of labor comes.
Yes.
So yeah. Also, I wanted to extend this to so if the mother is having stress during
Mhm.
pregnancy, so
Mhm.
what are the effects on the fetus during pregnancy?
Okay. So there are a lot of studies on this particular aspect, and it has been found that if the mother has a lot of stress during pregnancy, it affects fetus. There is something, there is a new hypothesis called a fetal programming. There are critical period of growth that happen in utero, and if something changes during that period, that changes the child throughout the life. Okay, so if the mother is very stressful, her cortisol crosses the placental barrier. Cortisol is one of the hormone which is there in maternal bloodstream. It goes it somehow
Yeah, which is highly
it
released during
yes,
stressful periods.
stress.
Yes.
Yes. So it has been seen that the placenta also produces excess cortisol in that particular period, and fetal blood levels are also increased. So these fetuses have more of anxiety, and when they are born, uh, it has been seen that they have low birth weight. There are chances of even sudden infant deaths, commonly if the mother has untreated psychiatric illness. Then early pregnancy infections, all these things are common through in the mothers who have anxiety, depression, or stress, which has not been addressed during that particular period. Then there are certain disorders like ADHD, autism. There are a few studies which have found correlation with the maternal stress and presence of these disorders. And certain children exhibit the IQs of certain children. If the mother has experienced severe stress or PTSD, the children's IQs, even after the 4 to 7 years after birth, has been reduced. So if the mother has experienced stress and that is not addressed during that particular period, it is going to affect child for rest of the life. Okay. um Means it has a very severe implications for the
Yeah, I
children
mean,
as well.
we never knew about this. Even being in psychiatry, I think thankfully to perinatal mental health, which has come up as a new topic, we are getting to know all of this because of the recent research. But while we were doing MD in psychiatry, I don't think we were taught about this or we ever read about this. So
There is
it's
just
very
a
nice that we took up this
simple,
topic.
yeah, there is
Yeah.
just, I think, one or two chapters that we have, and mostly that we focus on postpartum depression. But
And postpartum
the
psychosis. Those are the only two
psychosis,
things that we focus on.
yes, and then what
Yes,
medications
yes.
to give.
Ha,
Yes.
bus. Okay, so there is a question. Does the parenting class really help to bring up the child or for his or her bright future?
Okay, so the parenting class, I assume that you are talking about the during birthing class, means during before the birth of child, how to be around child for both mother and baby. Baby. So first, I'll say that there are no there are not studies, matlab, in science, that we need evidence by original article, research, meta-analysis. So as far as I know, there are no studies in India done in India, but these parenting class can help us to be around baby, how to take a practical care of baby, how to develop the attachment, proper attachment and bonding of the baby. So it might help, and it has been seen that the babies who are securely attached to their parent are good at learning. Okay, because when the baby is not securely attached, his or her learning is impaired, cognitive abilities are impaired. So in that way, not a direct correlation, but in that way parenting classes can help. But we have to understand that in India, that this thing is not very popular. I think only few metro cities might offer that kind of classes.
I think we
So
should start making it popular because I
yeah, yeah,
definitely feel that parenting classes should be taken for to be
yes,
parents,
yes,
how to treat
yes,
their children, how to talk to them, how not to talk to
yes,
them, how to behave, how not
yes,
to behave around them.
yeah,
All these things are very important. Which
yes, and
actually brings me
important.
to another question. Yes, ma'am. Sorry, please
Yeah,
continue.
yeah, no, no, but I'm saying that they also teach about the CPR of infants and children. What to
They
do when the
must.
child, if the child chokes, or what to do. So even these things at least to be known by all the dadis and whoever is going to take care of baby, उन सबको ये पता होना चाहिए. This is a very practically important thing. Yeah.
Very, very true, very true. And parenting classes, even for psychological aspects, should be taken, how to handle the
Yes.
psyche of your child, how to treat them, how to make them open up to you without fearing you. All these things should be taken care of. Which
Yes.
actually,
Yes.
yeah, which actually brings me to this question. that does a mother's own parenting, you know, how
Mhm.
she was treated by her
Yes.
parents or how she was brought up by her parents, does it affect how she will be with her child, or does it affect the perinatal mental health?
Yes. It is a very important question, and yes, it does affect. Initial 2 years of our life, we don't develop the language. Okay, but whatever the experiences we have now, all these experiences are stored somewhere. So these
True.
are stored in something that we called as subconscious, unconscious, whatever we call that, unconscious mind and something. So ये जो areas है ना, तो when the person herself develops the herself is going through the period of parenting. Okay, so whatever the biases she had, whatever the things she has experienced during her initial period or throughout her parenting will come, and she or he might not even realize that I'm doing the same thing that has happened to me.
Yeah.
Okay, so our own parenting affects, and if but it is not the end of the story. Okay, so if somebody has bad parents or some bad experience during childhood, it doesn't mean they cannot be good parent, but they have to be consciously aware of the biases that can come, and they have to correct it.
So I think again in those parenting classes, the parents, I mean the to be parents, should be asked about their parenting as well. कि उनके
Yes,
साथ तब
yes,
क्या हुआ था, and what are the
yes.
experiences that constantly come to their minds. And sometimes
Mhm.
we need to actually through psychotherapy take those subconscious experiences into the conscious so that they can actually speak about it,
Yeah, yeah.
and so that they get
Yes,
to know consciously कि आगे उन्होंने कैसा बर्ताव नहीं करना है अपने बच्चों के साथ. Because
yes.
I have
And
actually, I mean there have been studies, right, in which if you have had alcoholic abusive parents, or somebody has gone through child abuse because of their parents, so it might affect their own parenting, and probably hitting the
yes,
child, या फिर you know doing something with the child, scolding the child, abusing the child must be a very common phenomena in their mind कि यार यार ये तो होता ही रहता है, उसमें क्या है, हमने भी किया तो उसमें क्या है. So there is no
yes.
guilt.
There is a concept of generational trauma that you're talking about, the trauma that is going on from generation to generations, and because it is so
Yes.
normalized and nobody even
Yes.
realizes it. But at one person, just one person needs to break that cycle of trauma. One person who can make a conscious decision that I want to do better, I want to do things differently. If that is enough to break that cycle of transgenerational trauma.
Yes, true. I think only one person is needed for that कि एकदम से वो ट्रांसजनरेशनल ट्रॉमा खत्म ही कर डाले, आगे की जनरेशंस में सब कुछ अच्छा होता जाए.
That
Yes.
is a
So
ideal
also
picture.
that is an ideal picture. That is an ideal picture. Yes. So
Yes.
talking about this now, what do you have to say about now we talked about all of these adverse effects that have been happening, okay, during perinatal period. So are they reversible? Can they be reversed अगर एक बार already trauma हो गया है, already depression हो गया है, already anxiety हो गई है?
Okay, so yeah, they are reversible to certain extent. Sometimes certain things happen, like the trauma can be in any form. Having your child during pandemic can be traumatic. Having some earthquake during your antenatal period can be traumatic. So these things we cannot change, we cannot do anything about it. But the responsive early parenting and attachment has been seen to reduce lot of these adverse effects that we have talked about on the child. So if we are responsive, if we are there, if we have good attachment and bonding with our child during those initial period, the early life, the initial 2 years, that reverses certain adverse effect that we talked about. Okay? So
Can you also
it's
guide
not
our
like
audience?
hmm?
Okay, please continue.
No, yeah, yeah. So I was just saying that कि it's not like it's a मतलब कि ऐसे कि सफेद इस पे काली लाइन हो गई, अभी इसके बारे में कुछ नहीं कर सकते. It's not hopeless case.
Right.
Any time if you do intervention for the child, for the mother, it's going to have a positive outcome. Okay, So we have to be optimistic about this whole scenario.
Right. So, can you also guide our audience about the attachment theory that we have as to how can they effectively get attached to their child and how can they help their child to effectively get attached to them? Because in the beginning के 2 साल तो बच्चा ज्यादा बात करता ही नहीं है. So, non-verbally, how can they do that?
Okay. So every interaction, every loving interaction we have with our child is his way to develop a secure attachment, to develop a trust that world is a better place. There are people that are going to be there. So initial period, you say that bacha baat nahi karta, but the child is communicating. The child is communicating throughout from the moment he or she is born. The crying is a form of communication. And it has been seen that we need some practice, but we know the when the child cries like this, or every child is unique. When he makes certain gesture, that he is making this gesture, that means he or she is hungry. He is making this gesture, that means he is uncomfortable and it's time to change his nappy. Okay. So every time we are just being there, we are responding to child in loving caring way, we are helping him or her to develop a secure attachment. अब this does not mean कि अभी सारे काम छोड़ के हमने सिर्फ बच्चे के पास ही बैठना है. It doesn't have to be that way. We even if there are sometimes we are not available and some other attachment figure is there, uh, that is also okay. Okay. Sometimes child cries, so इस मतलब थोड़ी देर भी अभी attachment अच्छा है, इसका मतलब आपका बच्चा रोएगा नहीं. The child will not cry at all. It is also not like that. The child is going to cry. We just have to develop that kind of attunement with our child, what he or she needs at that particular time. Then the bonding, the breastfeeding, that is also one of the very good way to develop the attachment and bonding with the child. But it is not the only way. Okay. That has been told to us कि नहीं, the breastfeeding has to be done, but there are certain issues, there are certain mothers who cannot do that, and that is okay too. Okay. So being with the child, being guilt free about whatever we are doing and doing it with loving care is enough to develop secure attachment. And there are going to be lapses, there are going to be time when we might not be there 24/7. Sometimes we also need some break, and that is okay. But whenever you go back, just be present with the child during that time. So suppose it is for the father specifically. If you are working father and you have some time, so just time आप आपके baby के साथ हो, even if he is small, just be with them. बेबी के बाजू में बैठे और मोबाइल पे बैठे हैं, या फिर बेबी के पास बैठ के वी आर जस्ट थिंकिंग अबाउट वर्क रिलेटेड इश्यूज, डोंट डू दैट. दे आर वेरी perceptive. They know when the person is with me, is he or she actually present with me. That is very important. So giving us a little bit time of our day for our child and meeting all their needs in a loving caring way is a way towards attachment. Okay. And then be consistent caregiver, there should be at least one consistent caregiver at whenever when the baby is very young. And gradually we see that the baby is very dependent on us, and this is a journey of for the baby to discover his own independence. So attachment is also about letting child be independent when he or she is ready, giving child the choices. आई एम नॉट सेइंग दैट कि आप 2 साल के बच्चे को बोल दो कि तुमको जो खाना है वही खाओ, but you can give him or her some choice between two good healthy foods, what he or she wants. So that's how we can develop attachment, just being there and being present in a loving caring way. Okay.
All right, all right. So also there are people, I mean mothers who do not lactate, right? Like sometimes they cannot breastfeed or they cannot produce milk. So
Yeah.
what is your advice for such mothers? I mean, I am sure that they are put into a lot of pressure and then they undergo a lot of guilt because of that. So how would you guide them and their relatives especially?
Yeah. So mostly for relatives, I want to say that yes, breastfeeding is good, but it's not the only option. thanks to science, we have now found something, the formula milk, which is as near to the breast milk in whatever the qualities that they give. And more guilty the mother feels. See, even the breastfeeding and the breast milk secretion, it is dependent on mother's mental health. Whenever the mother is stressed, very much anxious and tired, the breast secretions reduced. Okay. So
Oh,
yeah. So if the mother is not relaxed, it you are not going to help, you are not helping the mother or baby in any way by stressing mother over the breastfeeding issues. Okay. So
I
we,
also
and
think
every
we
mother wants
can.
to, yeah,
Yeah, yeah, please,
yeah,
please.
yeah, every mother wants to do whatever she can 100% for her baby. It's not like she does not wants to do it consciously. Okay? And breastfeeding should be choice. If it is done both by both mother and baby in a very happily, it is going to be good. The breastfeeding which is forced, and then when the mother does not have, then people talk about it, it is also important cause for perinatal depression, postnatal depression, if the breastfeeding, if there is a breastfeeding failure. And we can just talk about the reasons for breastfeeding failure for 1 hour. There are so many reasons which are not in the hands of mother. Okay? And it can be choice also. Whether
Yeah,
means
to
the
this, I think
child
we can
rearing.
also add that, there are milk banks also available. A lot of
Yes.
other mothers have donated actually their breast milk so that it can go to the children of the newborn babies of the mothers who were not able to produce milk. So also there is this suggestion that you can look for those milk banks as well in your own cities.
Yeah, yeah, this is a very nice suggestion, Surpi. Yeah.
Thank you, ma'am.
Yeah. Yes.
Okay, so I think we have a question. Madam, being a working woman, there is always insecurity in my mind about the attachment with child. So please suggest something for it.
Okay. I can really see what you are going through, Pooja, because every day when we have to leave our child with somebody else and have to go, then that creates a little bit of guilt, little bit of insecurity in us. And that is also okay. So first of all, I want to tell you that whatever feelings that you have, whatever things you are going through, every feeling is okay. ओके. सो कोई भी फीलिंग गलत नहीं है, कोई भी फीलिंग बैड नहीं है. ठीक है. सो दैट इज वन थिंग. सेकेंड थिंग इज कि if you're feeling overwhelmed, if you're feeling that I have to leave my child and I have to go, you have to remember that your child is just a part of your life, very important, very big, but you had a life before your child came into the picture. Okay. So you have to remember that. And what is going to happen in some years, that the child is going to grow up, he or she is not going to need you that much. So if possible, if it is available to you, you can adjust your working, and how can you take care of the child. um, uh, that you can again. And second thing is that your attachment is not going to be affected because you were not with your child for 6 hours. Okay. That is very important thing that you have to remember. He or she is attached to you from the birth. You were there, you were the provider for him or her, and he or she looks up to you for security and love. Okay. So just because you're not there, it's not like the attachment is going to attachment is going to be affected. This is a very common misconception that we have, and it is nothing like that. Okay. So don't worry. And the another thing is that child can get attached to more than one person. Okay.
Hmm.
The children are very adaptable. Anybody who is there to take care of them lovingly is enough for them. And third thing, that we generally, what we do, okay, we feel guilty about leaving our child, so we leave our homes without telling him or her. This can be traumatic. So prepare your child beforehand, even if he or she doesn't understand, even if she doesn't understand
Okay, that's a
language
very valuable
that point.
advice. Yeah, because
Yeah.
generally
Tell
mothers
her.
actually they tend to feel कि मैं बता के निकलूंगी तो बच्चे को ज्यादा प्रॉब्लम होगी. But
No.
it's ulta, exactly
Ulta.
ulta.
Yes, tell her that, tell him or her that you are leaving, and when you will be when you will be coming back. tell her that mama is going from this time to this time. In between, somebody else is going to take care of you. You are not going to be alone. This person is there, and I will come back by that time. If by any chance, due to some work or something, if you cannot come back at that particular time that you have promised, apologize. Okay, so apologize to your child also. That is important, that in that way
Again,
we
a very
respect
valuable
that
advice, because
particular.
generally parents think कि बच्चे को अपोलोजाइज क्यों करना है, वो तो छोटा है, छोटों ने ही बड़ों को अपोलोजाइज करना चाहिए. एंड दैट इज अगेन यू नो इन आवर engraved in our tradition and in our culture, like Indian culture, कि बड़े कभी छोटों को सॉरी बोलो ही मत. You know, that is absolutely wrong and it should not be practiced.
Yes, yes. Every being deserves our respect, including our own children. Okay, so just make commitment and tell him. Sometimes the child is going to throw tantrums. ऐसा होने ही वाला है. Whatever you do, some days will be there that in that day he or she is going to feel bad about you going out. So that's okay. Whenever he is there, just give him or her space to express feelings, and that's it. Okay, just arrange some, but just take care of all the practical aspects, like who will be there when you will be gone, and tell that child from very early on. That's it.
Also, I think very commonly, okay, there is another question. As per theory,
Yeah.
anxious, ambivalent, or avoidant attachment types are a result of the child's sensing lack of attachment with the primary caregiver. How can these be taught to parents and by whom?
Okay.
Good question.
Yeah, who? Yeah.
Today we are getting a lot of
So
good questions.
questions, yeah, seriously. So I think a lot of mental health care workers can be help in this. We are talking about the parenting classes, means parenting classes before birth. So in that, all these things can be covered. Okay. It's just the anxious, ambivalent, or avoidant attachment, like you have said. It is generally that when the child feels abandoned, mostly, that they feel that my caregivers are not there, when there is inconsistency in caring for the child. Means sometimes they feel the caregiver comes, sometimes doesn't come. So all that, in that instances, that kind of attachment, there is a attachment trauma is there, and that develops those kind of attachment problems are developed. But we have to also see that these caregivers, nobody wants to nobody wants to harm their child in any way. So what is the psychopathology for these parents also, we have to take care of that. Sometimes they are going through a lot of mental health issues themselves, and so they are not able to available for the child. So this brings us again to the whole concept of whether that particular person was prepared to be parent at that time or not. And we have to work on the parent first. So it will not be just about teaching. We have discussed already the our own parenting experience will affect our parenting. So sometimes the parent himself or herself has been brought in by the parent who was unavailable, who was absent, and so their own whatever they have seen, whatever the modeling they are doing is of that particular attachment style. So I think for attachment, it is a very valid question and suggestion that we have to work on the people. Like Surbi also said that we have to work on parents, and whatever their preconceived notion, what are the parents narrative of their lives before they decide to jump into this journey of becoming the parent themselves. At the same time,
Yeah,
I don't
this
want to
this
make it
actually
very
brings me to
complicated.
this question that then what about the unplanned and accidental pregnancies? How does that affect their mental health?
Okay, suppose if the pregnancy is unplanned, and parent is throughout the pregnancy, if the parent is not happy with it, does not want to go through with it, but just gives birth because of social pressure, then generally that might also lead to the attachment trauma for the child and as well as for the parent. So the parenting should be a very conscious decision. It is a choice of bringing somebody into the world, and then we have to take care of that particular person at least minimum for 18 years. So it is a commitment for 18 years, and it should not be done for any other reason than I want to be parent. Okay. So sometimes now why we have children, the reasons are all wrong. Sometimes it is because ki hamare jhagde ho rahe hai, so the child will solve the problem. Sometimes it's because everybody is having children, so I should have. It should not be that. Being parent, I think, should be a very
Mhm.
conscious choice and decision. And when it's choice, we always take the responsibility for it. Okay.
That's actually true. I always talk in my talks, that in our Indian tradition, again, what happens is कि अगर husband wife की नहीं पट रही है, okay, so then what happens is that ultimately what is suggested is कि अरे नहीं बच्चा कर लो सब ठीक हो जाएगा. But I think that is the precise moment wherein you should decide not to have a child
Yes,
and
yes,
first
yes.
clarify their own issues and only then have a child.
Yeah. They should grow as a couple first. Uh, but it is an individual decision. We are not nobody. We are not judging anybody. But if we at least we should the two people should be comfortable being couple before deciding to bring other person into their family.
Right. So
Yeah.
we talked about all of these things, but what about those mothers who are infertile or those fathers who are infertile, but they still want a child and then they go for adoption or surrogacy and other options. So what would you suggest such parents? How should they be bringing up a child who has been adopted, or what should they be behaving as while their surrogate is going through pregnancy?
Okay. So first we'll go for the first part of adoption.
Adoption. Yeah.
Like we have discussed initially, it should be the choice and it should be the conscious decision. Okay. When you are adopting a child, it should not be like कि अभी थोड़ा सा problem हो गया, the child is not listening or some behavioral issues are there, so we cannot just return. मतलब if it was a biological child, we do not do that ना कि the बच्चा अभी सुन नहीं रहा है या अच्छे से behave नहीं कर रहा है, so I don't want to do it again. So I would suggest that just think about it, make a conscious decision to raise that particular child, and um, then you have to, if we take that responsibility, then we have to carry it through. Like every parenting journey, this journey is also going to have some good moments, some bad moments, and we have to be ready for that also. Okay. uh, Also, we have to sensitize our relatives as well, ki how they
Yeah,
are
which is
going to
very
approach.
important because
Yeah.
otherwise, again, in our society, adoption and surrogacy is looked down upon. Whereas it is such a beautiful thing to do, adopting somebody
Correct.
jisko koi sahara nahi tha. These are
Yes.
very beautiful things to be done, and it is still being looked down upon. So I think the relatives need to be sensitized more in this case.
Yes. Yes. And I think we should be clear with our children about that. Means some people try to hide it, something like that. Then child come to know from somebody else.
बहुत
So
बाद
it
में
also
कभी तो भी
affects, yeah, it affects
जो
child's
हम
trust.
बॉलीवुड की फिल्म्स में देखते हैं.
Yeah. I think
Yeah.
they show very extreme thing. I don't think somebody goes that much,
Yeah.
but we don't know. Yeah. And see, we then you have to decide. If you have decided, then you have to stand up for your child, even against some of your family. So if your family is not agreeing to this, so are you means are you willing to stand up for your child when time comes? That is a very important thing, and you have to ask yourself whether you are ready for that kind of commitment. Because even if we have that deep rooted need कि ये मेरा DNA होना चाहिए, and
हाँ,
that
typical,
is why I
typical,
will care.
yes.
Yeah. So uh,
कि
am I
the
going to
genetic pool should be continued anyhow. उसके लिए लोग क्या
yes,
क्या नहीं कर डालते हैं. मतलब if both the partners are also infertile in case, they will still go through that lengthy procedure of IVF, or they will go to the procedure of coming out of that, and they will spend lakhs and lakhs of rupees only to have their own genetic component in their child.
yes. Yeah, so how you want to become a parent is everybody's own decision,
In own
personal
decision.
choice. Yeah, so nobody should be there to judge. It should be between two people. And when but in Indian scenario, a lot of other people are involved, so we have to be very respectful towards them, but we have to maintain a very firm boundaries, specifically regarding adopt something like adoption, that these
True.
are the things that I will not tolerate to be talked to my child, or whatever the things. So there should be very clear boundaries with other relatives. That.
Right.
And regarding surrogacy, I have like I have said, during pregnancy, whatever the things, if we have to make that pregnancy easier, or as easy as possible for that surrogate mother, because whatever she is going to experience, whatever the stress she is going to experience, the fetus in her womb is also going to experience that. And we have already discussed what are the problems that a child can face after delivery if the mother. So just being there, taking care of whatever the medical issues that surrogate might have, might be helpful. And then again, just I think being supportive to that particular person who is helping you to realize your dream of becoming parent is very important, because that particular thing cannot be compensated in terms of money. It's above money, that particular. Yeah.
Absolutely. Also, now that we already talked about how to go about it, how to treat it, how to manage it basically, but what if these issues remain untreated? Then what can
Mhm.
happen?
Okay, so let's say that the person had depression or anxiety during whole antenatal period, or so what will happen is that जो routine चीजें है, जैसे routine antenatal checkup, taking your multivitamins, all these things will be impacted. Okay, so indirectly that thing also is going to impact the child. Then the person might also have, if the severe depression is there and if it is not addressed in any way, or the support that needed is not given to the mother, there are the chances of self harm also. Sometimes that self harm might be severe, or sometimes that might lead to some adverse pregnancy outcome as well. So if the antenatal stress or antenatal problems are not addressed, it is going to lead to the adverse pregnancy outcome. Okay, it has been seen that it is associated with the preterm deliveries also. And if the postpartum complication, postpartum mental illnesses, in certain patient there is a risk of harm to baby also.
Yes, yes, I was
The
actually going to
pregnancy
come to that what about the battered baby syndrome? Please also elaborate on that as well.
Okay,
Can the battered baby syndrome affect the
battered.
child long term? And what should be done with such mothers? Should they be separated from their child?
Yeah. So in case of let's differentiate these two things. Okay, sometimes in case of the psychiatric illness, if the mother has
Yeah.
severe depression or these illnesses, the mother is not doing things willfully. Okay, she has particular illness, and because of that, sometimes either she is not able to take care of the baby, or she has developed some kind of cognitive difficulty or delusion, the fixed belief that the child is not good or something, and she might harm child during that particular episode. Okay, so that is one thing. And we have to treat all these things with medication under the guidance of psychiatrist. If you see that there is a severe at that time, the separation of the mother and child and the strict supervision is needed. Okay, otherwise for anything the separation is not advised. Okay, but the battered baby syndrome that you're talking about is sometimes the people who have some personality issues or something like that, they harm their children. Okay, so we have to see that the patient with ongoing mental illnesses are different, and the people harm their baby during when they're sometimes they're angry, or sometimes due to some other issues that are going through their life. So the people who consciously harm their babies, that is a very different thing. So I just want to say that the people who have mental illness are very different, and a lot of things they do are not in their control. I have seen a lot
Right.
of patients who feel very bad about harming their baby during their psychosis episode, because they went into the depression when they realize what they have done. Okay, and this battered baby and everything, that is very different, that is kind of criminal offense. Okay,
Right.
so I think these
And
two
that is
are
done
different
deliberately.
issues. Yes, they
Yeah.
do it deliberately. Yeah,
Yeah. Yeah. Right.
yeah.
So what are I mean, can we prescribe psychotropic drugs during pregnancy and during lactation to actually curb all of this?
Yes. Surbi, we have discussed so far that a lot of these untreated mental illnesses have impact on mother, child, and even the people around her. It has a long term impact. Okay, there are
Yes.
certain concerns about psychotropics have negative impact on the baby, or they have impact on the birth or the organ, and the development of certain organs of the baby.
Yeah, and that is the reason a lot of
But
family members don't take these patients to psychiatrists because they think
yes,
that it
yes.
will harm the baby and the mother.
Yes. So we have to first see for every drug, uh, uh, we have to see that there is a risk of certain genetic anomalies or certain abnormalities in the baby, what is in the general population and what is with the drugs. I will tell you, if you see all those data, mostly the data is available with the US, we don't have Indian data, but if you see that there is a very slight difference even with the drugs like lithium. Okay, so whatever the data that is telling us is that if we do not treat mother's mental illness, that is going to be
Hmm.
more harmful for baby than the
Yes.
medications itself. Okay,
So I
we
hope,
have to
audience,
keep that.
this myth has been busted. So please, please, please listen to what she's saying very,
Yeah.
very carefully.
Yes, because we have to see the risk benefit in this equation. Okay, there are certain drugs which are to be avoided. We can shift patient during the pregnancy or during breastfeeding, and if the patient is maintained and is okay on particular drugs. So I say that having untreated psychiatric illness is more harmful for baby and mother than the psychotropic medications at any point. Okay, because a lot of people these misconceptions are even among the medical practitioners. A lot of doctors ask patient to stop psychotropic medication with these,
Hmm.
but we have to realize that organogenesis, that the baby के जो organs बनने का time है, when that happens during first 3 months itself.
Yes.
Okay, and generally when we realize that we are pregnant, it's around 6 to 8 weeks. So if you were taking
Yes.
medications, so already the baby has been exposed. So there is no
Hmm.
point in exposing baby again to the untreated illness part. Okay, I'm not saying
Yes.
all the medications are very safe and something, but the harm, the risk that the person will face on having no medication, without the cover of medications, will be far more than with the medications.
And secondly, I would suggest that you must trust your psychiatrists because they know exactly which drug is harmful, which is not, to which
Yes,
drug they can change to, or whatever. They know the risk attached with it and they know how to treat it as well. And some of the drugs, they don't even have much risk. So I think you should
yes.
let the decision be theirs and trust them fully.
Yeah, there should be the discussion. I think means most of the psychiatrists, they are forthcoming about what are the risks of the drug, but
Yes.
you discuss you, and depending upon, there are various options also. We are not in now the era in which we don't have options. We have options. Some other drugs can be given. We can switch a patient to some different medications, and with discussion and proper planning, the whole pregnancy and medication part can be handled.
Yes, that was a wonderful message. Would you now, we have actually reached the end of our session. So, would you like to give our audience some take home message before we do that?
Okay. I just want to tell you that for all the new mothers and father, every feeling that you have is valid, is okay, and nothing wrong in feeling bad or sad, even after having your bundle of joy with you. So please don't let anybody tell you that you're not good mother just because you're feeling sad or depressed or anxious ki, oh, what had happened to my life. Everybody feels that. And I am sure that everyone is doing 100% whatever they can do for their child and for themselves. Yeah, and most important thing, that take care of yourself along with your, when you're taking care of your child. That's it.
Yes. Thank you so much to my senior. Well, actually, she was my senior in the same hospital. We did MD in the same hospital. So, thank you so much for accepting my invitation for such an important topic. Because as I can see, there was a lot of good response today from the audience and a very good viewership as well. So, so it was an important topic to be covered. So, thank you so much.
Thank you, Surbi. Thank you so much for the.
So here at Evrox Healthcare, we actually care about your views. So please like, subscribe, and comment. Also, after this, whichever topic you would like us to cover, please mention that in the comments as well. Okay. And after this,
Hi.
we
Hi.
would be showing you the poster.
Hi.
Oh, okay.
Hi.
Hello.
Hi.
So after this, we
Oh.
would be showing you our poster on which our WhatsApp number is flashing. On that, you can text us
Oh.
whatever you want to, your suggestions, your comments also. And at Evrox Healthcare, we are hiring and recruiting a lot of doctors, healthcare workers, nutritionists, etc. So please contact us on WhatsApp so that we can show you the demo of our F1 app, which would be coming
Yeah.
out very soon. Thank you so much. And
Yeah.
okay, there is another
Chalo.
message. Excellent message by both the doctors, by Imtiaz
Okay.
Sheikh.
Okay.
Oh, thank you.
Thank
Thank you so
you.
much.
Yeah. So,
So please take care and have a wonderful night.
yeah. Bye, everyone. Bye.